Welcome to This Explainer. Okay, so have you ever popped a pill for a pounding headache and thought, what actually happens next? I mean, really happens. Well, today we're tracking that exact journey. We're going to follow it from the literal second that medicine enters your body all the way down to the microscopic molecular battles happening right on the surface of your cells. It's going to be a fascinating ride.
Okay, let's dive into this structured roadmap we've got planned. We're starting with what is pharmacology. Then we'll look at drugs, receptors, and ligands. After that, how agonists activate cells, and we'll wrap up with how antagonists block cells. Section 1. What is pharmacology? We are starting with the ultimate macro view here. Basically, pharmacology is simply the study of how drugs work inside the human body. And this entire scientific field, it splits cleanly into two distinct parts. First up, we have pharmacokinetics. This is all about what your body does to the drug. Think about how it absorbs it, distributes it, and eventually clears it out. Then there's pharmacodynamics, which is kind of the flip side. This analyzes what the drug actually does to your body once it reaches its final destination.
Now, medicines generally come from two places. You've got your natural drugs, meaning ingredients derived straight from plants or nature, and then you have synthetic drugs, which are completely synthesized right in a lab. So the crucial point is that whether a drug is naturally derived or synthetically engineered, its core mission is exactly identical. It's there to fundamentally alter your body's normal physiologic state, whether that's for medicinal or recreational purposes.
Moving right along to Section 2, drugs, receptors, and ligands. Time to zoom in and check out the cellular game board where all this physiological action actually happens. The absolute most important pieces on this cellular game board are your receptors. You can literally think of them like microscopic molecular locks. They are just proteins resting right there on the surface of our cells, basically just hanging out, waiting to receive specific chemical information. Now, if those receptors are the locks, well, the ligands, or substrates, are the keys. A ligand is simply anything, any chemical or drug that perfectly binds and interacts with a receptor's active site. When that biological key slides into the cellular lock, boom, it triggers a very specific response inside that cell. And this brilliantly illustrates how it actually plays out in real life. Let's say you've got an awful stomach ache with diarrhea. You take drug A. Now, drug A is specifically designed to mimic a natural hormone in your body. It travels down, and it perfectly fits right into the receptor A lock. That perfect binding triggers the cell to intentionally slow down your gastrointestinal motility. And just like that, the diarrhea stops. Section 3. How agonists activate cells. Let's talk about these activator keys. The drugs that actually turn these systems on, we call those agonists. But not all activator keys are built the same. We're going to look at partial and inverse agonists in just a second, but take a quick look at the others first. Full agonists. They give you a complete 100% full throttle response. Irreversible agonists are exactly what they sound like. They bind permanently. Once they're in, they are not leaving, regardless of what other drugs are floating around. And selective agonists are super targeted. They only target specific regions, so they might activate a receptor in your lungs, for instance, but completely ignore that exact same type of receptor over in your FERT. Let's look a little closer at partial agonists. These are incredibly useful. They bind to the receptor, sure, but they only induce a submaximal or partial response. Why does that matter? Well, it makes them absolute game changers for treating and avoiding drug dependencies. Take buprenorphine, for example. It induces a similar effect to stronger opioids, so it satisfies that physical craving, but it's much less potent and less addictive, which really helps patients safely taper off. Then we have inverse agonists, and honestly, these are truly fascinating. They bind directly to a receptor, but instead of turning it on in the traditional sense, they induce the exact opposite biological effect. Common H1 antihistamines that you take for allergies, like diphenhydramine or loratadine, those are inverse agonists. They don't just passively block a hormone, they actively bind to the receptor to trigger the exact reverse of an allergic reaction. How cool is that? All right, Section 4, how antagonists block cells. We're shifting our focus from the activators to the molecular blockers. So if agonists are the keys that turn things on, antagonists are the chemical shields that shut things down. Let's revisit our stomachache scenario to see this from a totally different angle. Normally, hormone Z binds to receptor Z and increases your gut motility. To stop the diarrhea this time, we introduce an antagonist, drug B. Drug B physically blocks that receptor's active site. Hormone Z is totally locked out.
Because it can't get in, motility slows down naturally, and the diarrhea stops. Now, antagonists basically have two distinct strategies. First, you have competitive antagonists. This is a direct head-to-head fight. The drug and the body's natural hormone battle it out for the exact same active site on the lock. If you pump in enough of the drug, sheer concentration wins the battle. But then you have non-competitive antagonists. And these guys, they are so much sneakier. They don't fight for that main active site at all. Now, what's really interesting about this slide is how this stealthy blockade actually happens. It all comes down to the allosteric binding site. Basically, a lot of these receptors have an inactive side door. A non-competitive antagonist drug comes along and binds directly to this side door. And when it does that, it physically deforms and alters the shape of the main active site. So when the natural hormone comes along and tries to insert its key, the lock is completely mangled. It just won't fit. It's literal molecular sabotage, and it does it without a single direct fight.
And there you have it. We've tracked the keys, the locks, the activators, and the sneaky saboteurs that make up the whole foundation of cellular pharmacology. So I'm going to leave you with a quick thought. The next time you open your medicine cabinet, will you know if you're taking an agonist activator or an antagonist blocker? Think about it. Thanks so much for joining me for this explainer. Stay curious, and I'll catch you next time.